Any questions? Any questions that you have related to the immune system or blood? How about the rest of you? Questions? Questions? All right, so let me start today with the in-class activity questions, just to have a quick overview of chapter 21. So the immune system is, as you've watched the video recordings, has two main types. So immunity has two main types. Can you remind me, what are the two main types of immunity? Innate immunity, and the innate immunity, if you remember, it's the non-specific immunity. It doesn't target the pathogens specifically. So I don't have a special cells that targets measles or rubella or cholera or mumps or diphtheria or whatever. So they act non-specifically. They will be acting against any viruses, against any bacterial cells. This is the innate part of the immune system. And the second part, the second type of immunity, is the adaptive immunity. And the adaptive immunity has three main characteristics. First, it is specific. What else? What else? So I have special cells that will be targeting the pathogenic cells specifically. What else? What are the other two characteristics? Very important characteristics here for the adaptive immunity. Specific, it's systemic. So it reaches all the body organ systems and has memory. Great. So once I get exposed to a special virus or a special bacteria, my adaptive immune system keeps a record of this infection to respond much faster and in a more effective way whenever I get re-exposed to the same virus or the same bacteria. So adaptive immunity has three main characteristics. It is specific, it targets pathogenic cells specifically, it's systemic, it reaches everywhere, it is conducted through the blood, and it builds an immunological memory. It has memory. Great. So when I look at the innate immunity, I will see that the innate immunity is going to be divided into two sets of immune defenses. I have external defenses and internal defenses. What are the two main components of the external defenses of your innate immunity? Another name that we use, those are the surface. That is exactly. So the outermost covering of the body, this is going to be the skin. It limits the amount of pathogenic cells that can penetrate to cause an infection, to replicate inside my body. And the mucous membranes that are lining all the internal body cavities, lining my nasal cavity, my oral cavity, my esophagus, my stomach, my airways. So all those internal cavities are lined with mucous membranes, and you're going to be releasing mucus, and this mucus going to contain antibacterial, antiviral chemicals like the defensins, for example, if you remember, like the hydrochloric acid in your stomach that kills most of the bacteria that you're ingesting with the food. So here, acting as surface barriers would be your skin and mucous membranes. How about the internal defenses that act non-specifically, part of the innate immunity? We did have cells, we did have chemicals, and we have two immunological responses that act non-specifically as part of the innate immune response. So let's start with the cells. What are the three types of cells that would be acting non-specifically against any kind of bacteria or virus? We've got two phagocytes. Two of the three were phagocytes. The two phagocytes that we have are my macrophages. And remember, those are phagocytes living in your body organs. So you have macrophages living in your lungs, those are the dust cells. You have macrophages living in your liver, those are the Kupffer cells. Those are a type of phagocytes living in your tissues, in your organ tissues. The second type of phagocytes, those were circulating in the blood, they are highly phagocytic. We give them a nickname, they are the bacteria slayers. What did we call this type of white blood cells that are highly phagocytic? Those are my neutrophils. A third type of immune cells that will act non-specifically, those are targeting mainly the viral infected cells and cancerous cells. Those are what we've called the natural killer cells. They are always checking the self-antigens on the cells. If a cell fails to present its self-antigen, convincing the natural killer cells that it belongs to the body, what's going to happen? The natural killer cell will become activated and will start to attack this viral infected cell or cancerous cell. We've got two chemicals on here. Two chemicals. If you remember, one of the two chemicals was released from the viral infected cells. So you've got a cell in here. The virus infected the cell by injecting its DNA, its genetic material, to be integrated with the cellular DNA. And as a result, the cell start to turn on specific genes that code for this chemical. Those chemicals will be released to the outside of the cell, remember, as SOS messages that are sent to the neighbor cells for me to give a warning to the neighbor cells that there is a virus that is targeting the cell. And this gives the chance to the neighbor cell to form antiviral proteins to block the replication and preventing the virus from taking over this neighbor cell. Do you remember what do we call those chemicals that will interfere with the viral replication? What do we call those chemicals that will interfere? Those are my interferons. All right, so another type of chemicals that we've seen as part of the innate immunity was a set of plasma proteins that will become activated once I've got an antigen antibody complex. So I produce antibodies by the adaptive immunity. Let's say I did mark a bacterial cell. So I've produced antibodies against this bacteria. This will activate a set of chemicals that will then form pores within the plasma membrane of the bacterial cell, causing the bacterial cell lysis, causing the destruction of the bacterial cell. Do you remember what do we call those chemicals that will become activated? Those are my complement proteins. This is my complement system, exactly. Two other innate internal immune responses. One was responsible to bring more immune cells at the site of the infection, was responsible to localize the infection, prevent its spread. It also sets the stage for the repair by bringing the fibroblasts as a site of infection for them to start the repair of the damaged tissues. Do you remember what is this immune response? That is characterized by being responsible for redness. The affected cell is going to be hot, tender, and swollen. This is going to be exactly inflammation. Remember, inflammation is a non-specific immune response. Non-specific immune response. All right, so another non-specific immune response that we're looking at. This other one was responsible to do what? To boost my metabolic activity. At the same time, it enhances my liver to sequester the iron and zinc away from the bacteria to prevent the bacterial cell replication. Do you remember what enhances my metabolic activities given a chance for my bacteria to rapidly proliferate, to become activated, to produce more antibodies, for my cells to repair themselves and build up the tissue? And in the same time, It enhances the liver cells to capture the iron and zinc away from the bacteria to reduce the bacterial cell proliferation. If it was persistent or too high, this is going to cause damage to my own proteins, causing a protein denaturation. This is exactly as you are mentioning the fever. So, what are the two main components of the adaptive immunity? So, discussing all the different components of the innate immunity. What are the two types of adaptive immunity? Yeah, humoral immunity, exactly, and cellular immunity. All right, so do you remember another name for the humoral immunity? Do you remember another name for the humoral immunity? It's the antibody mediated immunity, exactly. It's antibody mediated. And the cellular immunity, what was the other name for cellular immunity? It was the cell mediated immunity. Cell mediated. So, what are the two types of cells, of white blood cells, that are going to be responsible for the humoral immunity and the cellular immunity? For humoral first, question number 11 here. So, for humoral immunity, what type of white blood cells are going to be responsible for mediating the humoral immune response? It's going to be my B lymphocytes. And which cells are going to be responsible to mediate the cell mediated immune response? Those are my T lymphocytes. Do you remember where both B and T lymphocytes are getting produced? Where do they get produced? Both B and T lymphocytes. Exactly, they are produced like all blood formed elements from the red bone marrow. And remember where they get their education. And what I mean by being educated, I am becoming an immunocompetent cell. Remember where those B lymphocytes are becoming immunocompetent. Where would they get their education? Remember, B lymphocytes are getting their education locally. So they get their education in the bone marrow. Where they got produced. And how about the T lymphocytes? Do you remember where do they get their education? Yeah, they get their education to become immunocompetent cells in the thymus gland. Thymus gland. What do I need to learn in school? Either in the bone marrow for the B lymphocytes or the thymus gland for the T lymphocytes. What are the two main things I need to learn to become an immunocompetent cell? What do you think? Recognize and bind one specific non-self antigen. Exactly. Recognize and bind a specific non-self antigen. So each one of those B and T lymphocytes will be capable to recognize one specific non-self antigen. What is the other thing exactly? To have self-tolerance. To develop self-tolerance. And in order for me to develop self-tolerance, I need to pass through how many selection processes? Do you remember? How many selection processes do you have in order for you to develop self-tolerance? I have two selection processes. Exactly. I have the positive selection and the negative selection. In the positive selection, what am I selecting the cells capable of? I'm selecting the cells capable of recognizing a special self-antigen called MHC, major histocompatible protein. In the negative selection, I am selecting which cells? The ones that are not able to recognize any other self-antigen. So again, in order for me to ensure that I don't develop an autoimmune disease, those cells need to learn to become self-tolerant. How do I become self-tolerant again? By being able to recognize MHC and to not recognize any other self-antigen. So looking at the B lymphocyte actions, remember when the B lymphocytes get exposed to an extracellular antigen, they will become activated, they will proliferate. Some of those B lymphocytes will become the effector B lymphocytes that are going to be producing the antibodies, or what we call the plasma cells. Some of the activated B lymphocytes will be kept in a semi-activated form called the memory B lymphocytes for them to respond as fast as possible whenever I get re-exposed to the same antigen. So how this humoral immunity is gonna work? What are the main functions of the antibodies? The antibody mediated immunity. So what is actually the antibody those antibodies are doing for me? What are the four main functions of the antibodies? Yeah, exactly. If I'm dealing with a toxin that might damage my cells, those antibodies will bind to the toxin, causing the neutralization of the toxins. What if I'm dealing with low molecular weight antigens? It's so hard to capture and attach. So I will be binding to them antibodies for me to increase the molecular weight and for them to precipitate. So I'm allowing the precipitation, which triggers the inflammation and triggers the phagocytosis. What else? If I'm dealing with cells, exactly, we'll be attaching multiple cells to one another as if I'm using a glue to attach those cells. We call this process is the agglutination. All these three here, neutralization, agglutination, and precipitation, are gonna be enhancing an inflammatory response, enhancing inflammation to take place, and phagocytosis. What's another highly critical function here of the antibodies? Fixation and activation of what? What am I fixing and activating? Complement. Alright, so complement, if you remember, what triggered the complement? Those plasma proteins. Remember? What triggered them to become activated and to form the pores to rupture the bacterial cell was the antigen antibody complex. So I'm allowing complement fixation and activation. This is what results in cell lysis, breakdown of the cell. Remember, the complement proteins will become activated, will form pores within the cell membrane of the bacteria, causing the bacterial cell to rupture and get damaged. All right, so how can I get antibodies? What are the different possible ways by which I can get antibodies? Or in other words, to get a humoral immunity. We have four types of humoral immunity. What are those four types? What are the possible ways by which you can get antibodies? Yeah, Marha, artificially, it's missing something. Artificially what? Artificially acquired, naturally acquired passive, naturally active or passive. So it might be artificially acquired active. What I mean by this, I've gotten I've got a vaccine. This vaccine is something artificial. It's not natural. And it's active. Why? Because it activates my own B lymphocytes to develop the antibodies. What is the importance of having an active humoral immunity is that it's gonna be giving me an immunological memory. So here, an artificially acquired active, it's gonna be developing an immunological memory. This is like getting a vaccine. It might be artificially acquired, but it's passive. What are we urging anybody who has recovered from COVID-19 to do after he recovers? To do what? Stay home after recovery? Yeah, donate blood, donate plasma. Why do we urge people to donate plasma after they recover from the infection? To extract the antibodies. And who gets those antibodies? Sick patients. Those ones who need an immediate protection. So it is passive. You are not the one who has produced those antibodies. You get pre-formed antibodies. So we extracted those antibodies from the plasma of the recovered patients, and we've given those antibodies to sick people to get an immediate protection. With this immunity lost, would I develop memory here, getting this kind of protection? No. So here I'm relying on preformed antibodies, artificially acquired. I get an injection of those antibodies. It might be naturally acquired. Active, like doing what? What's going to be considered a naturally acquired active humoral immunity? Getting an infection. getting an infection. That's why people, when you open the news, people are saying, yeah, we might be reaching a herd immunity sooner than what we think. As we've got 80 million people who got the vaccine for COVID-19 and many others who got already infection. So the infection develops some sort of immunological memory. Alright, we're not sure about COVID-19, whether this immunological memory lasts for how long. It's much more complex when we're dealing with viruses because viruses keep changing their shape. So I might have a memory against the virus, but because it modified its shape, when I get re-exposed to it, my immune system fails to recognize it. All right. It might also be a naturally acquired passive. How do I get a naturally acquired passive? How to get preformed antibodies naturally, yeah, during pregnancy? Can you remind me what kind of immunoglobulins is capable to travel through the placental barrier? Do you remember what is the type of immunoglobulins of antibodies that is capable to travel through the placenta? It's small, it's a monomer, has only one unit. IgG, exactly. IgG. So during pregnancy and by lactation, breastfeeding. So breastfeeding, lactation, what kind of immunoglobulins is a mother given to her child by lactation? What type of immunoglobulin? So during pregnancy, you're gonna be given IgG, but by lactation, remember which one is the immunoglobulins that gets released with the body secretions? Exactly, this is IgA. So the one that crosses the placenta is IgG, and the one that will be released with the milk, it's an IgA. All right, so can you tell me here uh, two forms of T lymphocytes? Can you tell me what do we call those immunocompetent naive T lymphocytes? Can you give me two types of T lymphocytes? Exactly, CD4 and CD8 cells. What is the active for each of them? So for CD4, what do we call the active form of it? And for CD8, what do we call the active form of it? Yeah, for CD4 becomes, once activated, becomes a helper T lymphocyte. And for CD8, it becomes the cytotoxic T lymphocyte. And do you remember what MHC class recognized by the CD4 cells and by the CD8 cells? Do you remember what MHC class is being recognized by CD4 cells? Yeah, so MHC class 2. And how about CD8 cells? Class 1. Great, great, great. Any questions? Questions? All right, so this is pretty much everything I wanted to go over with you today. So today we've got those 31 questions for as part of the in-class activity.